One-on-one with Kim Therriault. Leadership and Haven. What has Haven meant to you?
Haven has been my haven. This is a place that I have always dreamed of working. My very first hospice job was like this a lot. And we were really there for each other and learned and taught each other. There was no hidden agenda. There was nothing else that we needed to do other than take care of each other and take care of our patients. And so that's one thing that I felt was really important here at Haven whenever we started the hospice program, was that we are going to be here for each other. Hospice is a very hard job. It's mentally, emotionally, and physically difficult. And the nurses and the chaplains and social workers and our CNAs, they are dealing with death and dying at every single visit they do every day. And they're dealing with people in all of the stages of grief. And it can be really weighing. And so it was really important for me that the staff had a place to go where they could cry, whether they could be upset, they could be angry, they could be want to tell a story. They wanted to make sure they had done the right thing and not be judged for not knowing the exact answer or the exact thing to say at that point. I wanted them to feel safe too. Most people in their lives, they deal with death and dying 2 or 3 times, 4 times in their lifetime. And our staff deals with it 4 or 5 times a day. And I wanted them to have a safe place.
What are you most proud of building, protecting, or nurturing here?
I think one of the things that I'm really proud of is that we do hospice old school. And it's okay to cry. It's okay to hug. It's okay to hold their hand. We're not in there to make sure they don't have any symptoms, or if they do, that we're going to give some pills and we're out the door. You know, we want to be there for the patient and their family and meet them where they are. And if they want to sit and look at pictures, we want to have time to sit and look at pictures. If they want to talk about their life and some of the good stories and some of the scary stories or some of the bad things that's happened to them in life, it's really important that we're there for them at that moment. Years ago, my mentor that I had after nursing school had told me, she said, Kim, she said, they don't remember the nurse that got their IV stick on the first try. They remember the nurse that took time to sit at their bedside and hold their hand and listen. And for me, that's what's important. Our patients and our families need to be heard. They need to be listened to. They do not need to get half of a sentence out and we already have it in our mind what they're going to say, and we're stuck on that. We didn't listen. We didn't hear what they needed to say. We didn't take time to learn the relationship between the daughter and her mom or dad or the spouse, you know, the rocky years, the great years. You know, when you take time to learn who they are, it gives you a better idea on when they have a question or they're not sure about something, to where you can tell them, you know, what you're doing a great job. And if your mom was able to tell you today, she would thank you and tell you what a great job you're doing.
What kind of culture did you hope people would feel when they walk through our doors?
That they're safe, that they can come into my office at any point and I will be honest with them. Even if they have done something that could have been done differently, we're going to work together and we're going to figure out what could be done better the next time. Not to beat somebody up, but because, you know, one day I'm going to retire and I want the next generation of hospice to do it the same way that we've done it. To be there for each other, to support each other so that we can go out there and support and take care of our patients and the families.
What do you hope your team carries forward?
I don't want them to ever forget, even when they move to, things in our life is done in a season. I never expected my season in the hospice to be 26 years. I thought I would do it for a couple of years, just like I'd worked at the hospital, I had done doctor's office. I thought it would just be a few years and I'd move to something else. But this has been a calling for me. I wasn't called to an inner city. I wasn't called to a foreign country. But I don't think you can do this kind of work for any length of time at all and it not be where you're supposed to be. But everything has a season. And for our staff that leaves us, I want them to carry a piece of Haven with them always. I want this to be such a good experience for them, even if their season was a year or 2 years or 6 months. I want them to carry meeting a patient where they are, not being judgmental, accepting them for who they are. Doesn't matter what a patient tells you, there should be no judgment on our faces at all. In the same way for my staff, they can come and tell me anything and they're not going to see judgment on my face because I want to help them through whatever it is that they need to walk through. I want to help them through that.
What would you say to the nurses, aides, chaplains, social workers, volunteers, and staff who have walked this road with you?
Oh gosh, they have taught me so much. Everybody has such a different personality and different goals and different ways that they handle things. There's not one way to handle something. There's a lot of ways, and it's always better when you do it together. And as long as you've got that safe place to be able to come and talk about things where if you're upset with the way you were treated at a home, for instance, or what you saw at a home upset you, that maybe there was some strife going on, let's sit down and talk about it. What can we do to help? Is the caregiver just exhausted? Do they need respite? Do we need to send a nurse more often? Do we need to send an aide more often? What can we do to help relieve them a little bit? So just working together. And I think that's really, really important, especially in healthcare. Instead of everybody working in a silo, that we come together.